You have to hand it to our hands. They do a lot of work for us. But as we get older, our hands themselves may need a little hand holding. Painful cramps can put a crimp into all that our hands can do. Dr. Kevin Malone is here to put his finger on the most common ailments and to hand over ways to alleviate them. Dr. Malone is an orthopedic hand surgeon at Metro Health. Welcome to the show.
Thank you very much.
Okay, the first painful problem we have to talk about is carpal tunnel syndrome. Is this happening because everyone's using their computers so much these days?
No. There's no evidence in any of our medical literature to support keyboarding as a cause of carpal tunnel syndrome. Certainly bad posture and technique and ergonomic issues can contribute to some of the symptoms, but keyboarding and typing is not a cause for carpal tunnel syndrome.
Okay.
Old wives' tale.
So what happens? What does cause it?
Well, in many cases, as we age and the shape of our hand, the shape of our wrists change, there is a small space where the nerves and the tendons have to glide through to get into the hand from the wrist, and that space becomes smaller for various different reasons, and the nerve doesn't have the ability to stand up for itself. And as the nerve, the median nerve, becomes squeezed within the carpal tunnel, you start to develop first pain and sensation changes in primarily the thumb and the index finger and the middle finger, and this can progress to numbness and weakness.
Okay. Stopping your hand from doing all these things. So what kind of treatment is available?
Well, really there are three mainstays of treatment, and where the treatment is initiated depends on the severity of the condition when the patient presents.
Sure.
Early on we have good success with simple solutions such as splinting our wrists at night to keep them straight. Oftentimes the patients feel like their hands fall asleep at night and wake them up. Other early treatments can include steroid injections into the carpal tunnel to try to decrease some of the swelling around the nerve. And then ultimately, many of these conditions do require surgical intervention to stop the progression of the nerve dysfunction.
Okay. Well, the next painful thing is trigger finger. Are we going to the shooting range, or what's trigger finger?
Hopefully not. Trigger finger is another common condition, and its cause is fairly similar to carpal tunnel syndrome, and it has to do with things changing shape and size. And as our fingers, as our tendons that bend the fingers move into the fingers, they have to enter into a tight tunnel. And in the normal environment, they glide very freely without friction, but as things change size and shape, friction becomes involved, and patients start to complain that their fingers catch, click, pop, or even get stuck into a flexed position.
Okay.
And that can be quite painful.
Ooh, more pain. All
Yes.
right. And is there a cure or something to do?
Well, there are some things that we can do here as well. Medications and exercises don't seem to do very much. Steroid injections here are also a mainstay of treatment and can be very effective if started early. And then for patients who are not candidates for steroid injections or who have failed those type of treatments, there are also fairly straightforward surgeries with easy recoveries.
Okay. And third is arthritis. Is that just natural aging?
It is, and the most common joint that we see involved in arthritis in the human hand is at the base of the thumb, and this is the joint that gives us the opposable thumbs that sort of allows us to use our hands for more activities. And the stress demonstrated at that joint with simple pinching and grasping is quite significant, and over years of abuse the cartilage starts to break down, and arthritis can be quite problematic and painful.
Okay, and I assume that the treatment is the same, so...
Well, yep. So early on, arthritis-type medications can be effective, activity modifications, simple solutions.
And hopefully not getting into all that surgery. Do something about it before it happens.
Many times we can treat without surgery.
Okay. To get a free information sheet on Metro Health's hand surgery program, just call 216-778-4131. And I have to hand it to Dr. Malone for giving us such great information.
To find out more, call Metro Health at 216-778-1003 or click to www.metrohealth.org. Next, protecting your home when you need a nursing home.